and then I'll struggle through sharing our slides here. So as Christiana mentioned, this is a continuation of our series introducing the child family behavioral health staff and what they do. And today's presentations are a little bit longer than the previous ones we've had. Um, and as Christiana mentioned, we'll start with Fran. Fran, you can take it away as soon as I manage to share these slides.
All right. Hey, everybody. Fran Pearson. I use she, her pronouns. I think the first slide you'll probably see that's mine is we'll just give you kind of a good sense of who I am as a human. Oh, good. I'm glad you put that up. Who I am, what I do, who I interact with. I forgot to have that right next to me. Okay, cool. So who I am. So the next slide, you'll see, will tell you everything you need to know about me. These are my guys. My husband Jay is in two of the pictures, and my 11 and a half year old pup Dante is there as well. Those are from Arizona, and I think the middle picture is from Oregon. It makes us look like we are like avid hikers or outgoer, outdoor people. That's what we strive to be. That's probably what I want you to see. But so that's what I'm putting up there. No, but that's where we're happiest. And hi Grace. Um, and yeah, so just a big part of who I am. And I've lived in Oregon for 4.5 years. I've been with OHA for 4 years. I started in January 2020. Let's see what I do. I just have a couple slides just to kind of keep me focused on what I wanted to talk about. The two programs that I work with are the slides you're going to see. So the kind of the what I do. So what I do is I support programs doing school-based mental health. So some of you in this meeting have already heard this, but so school-based mental health is a program that's supported through legislative general funds, and we pass them through to local community mental health programs in rural counties. These rural counties, these aren't all of the rural areas in Oregon, as you can clearly see, but the ones that are highlighted in blue are the ones that are currently receiving funding, those community mental health programs, rather. The goal of the funds is to increase mental health service access in schools to students and families. These funds started back in 2014 and with around $1 million at the time. And it's now at 5.2 million per biennium, or basically 2.5 million a year. I don't think I put this on here, but it's that funding supports, partially supports 16 community mental health programs highlighted in those counties that you see. And what I've learned, because this funding was already in place and these counties were already receiving these funds when I started, what I learned is that the counties and the areas were prioritized because they didn't have many school-based health centers. If anyone here is familiar with a school-based health center, those the people in OHA who oversee the school-based health centers live in a different section of OHA. It's not part of our unit, it's part of public health. And a lot of those school-based health centers or school-based health clinics, a lot of them have mental health therapists. So OHA wanted to make sure and support other regions, other areas of the state that didn't have access to a lot of those clinics, or didn't have access to a lot of therapists in the area, or had to travel long distances. We're supporting not all the schools or districts in those counties. The money goes to those community mental health programs, and we're asking them to have their therapists and skills trainers go into the schools that they choose to partner with. These programs know their community and their schools best. Some of them have long-standing relationships with their schools and districts. They use other funding to kind of, cobble things together to make sure that they can, have services in place in the schools. I think I said, so yeah, so 16 programs, and that's across 17 counties. There's the one up there covering Wasco and Sherman. That's one agency that covers both. So right now, I think they have therapists and skills trainers that are in schools anywhere from the whole week. That's their full-time place where they work in the school, or maybe a couple days a week. And so it's about 82, 81 or 82 schools this school year that they're in. And so that is one of the programs that I support. So I guess in terms of like how I show up for these programs is just providing technical support. Some good examples lately that I could give you. There's a rural county mental health program that is a little newer to the funding, and they are just wanting to make sure that they're forming a good connection and good partnership with their local schools and school districts. So I've been meeting with the school employees and the community mental health program and just talking to them about how the flow of services, referral and assessment, and what needs to happen to get things in place so that um, the therapist or the skills trainer can start meeting with the student, and all the things in between that. So a lot of technical assistance. I've done this work uh, years ago, and I love it. I worked for a community mental health program, and I worked in several middle schools. Um, I love working with young people, with adolescents, and so now I get to help support the programs to do this work. Um, so yeah, and they send in reports every few months just to let us know, what kinds of things they're doing, what things are going well, what could be better, what they're working on, maybe challenges. So yeah, that's kind of a way that I get to kind of still, stay connected with them. I'll do check-ins virtually with them, just to learn how things are going. If there's, major issues or things we need to talk about, they know they can always reach me because I'm in front of my computer on my email, or they can text or call. Um, and then the other program that I support in the same way is mental health promotion and prevention. And I think that'd be the next slide. Tried to kind of give a similar visual, but I just kind of wanted folks to see where same general legislative funds, where they are in Oregon. And this was a little different. Programs about, I don't know, almost a decade ago now, applied for the funding. And they also will braid it or, you know, pair it with other funds to do amazing things, which we don't have to go there yet, but it'll be on the next slide just to give you some examples. But I just kind of wanted folks to see some of the variations and kind of where and who these agencies are. So like, for example, just a couple, Best Care Treatment Services in Jefferson County. Um, that's a community mental health program. And then you have programs in Umatilla and Union County that are doing really good care coordination and resource navigation work. And those are county employees. There's also a lot of local public health folks that are doing lots of amazing things too. So I just kind of wanted to make sure and represent the agencies on that map. Um, the funding almost the same. It's about 4.5 million for a biennium, or a little over 2 million a year to these programs, which it's 22. Some of these, like on the left hand side, inter community health network. That's a CCO, and they actually fund Lynn, Benton, and Lincoln's community health programs. So there's actually, there's, I think, 19 agencies that are receiving the funds, but some of them are working together. There's like a regional group that works together. So it's actually, um, yeah, actually that, uh, I'm, okay, Jenny. Hi, Jenny. Um, help seeking behaviors. That is actually, I think it is interesting framing. And it's newer to me too. Also the help giving behaviors. But I think I've learned that term and I've kind of started to use and adapt that term for myself from these programs. They use this term quite a bit, and they I think when they say that they're trying to encourage people to feel okay about asking for knowledge or information or a resource or seeking help. So I think that's just yeah, that's how they say that.
I feel,
Yeah.
oh,
Mhm.
yeah,
Yeah.
it feels a little dehumanizing and behaviorist to me. And it just makes me concerned because it feels like looking at the behavior instead of looking underneath the behavior, which is something I see happen all the
Mm,
time in behavioral health.
thank you so much. That's really good feedback. It's like you hear these terms or phrases and how it lands with people and what it feels like to hear those words. Words matter. So I really appreciate that. Definitely I want to think on that some more. So I really appreciate you saying that, Jenny. Um,
Thank you.
yeah, yeah, no worries. Um, So yeah, so I mean that really the main goal of the funding and of these programs is to just build awareness in the community around mental well-being, mental health, good mental health, what that could look like, resources in the area. Um, if you're not feeling well, where to go if you are needing help. Um, so we can go to the next slide. These are just some examples of um, what these programs do, how they prioritize their work, and yeah, and what they're doing. They each every year they turn in a work plan, so it basically outlines here's the different activities that based on our local, national, state data, these are the things that our communities have told us they want us to be focused on. Um, that our community is saying that they need, and so each of the programs they might have two strategies, they might have a couple different other activities and things. So but yeah, so 62 different activities and strategies that these programs have identified as being important and critical in their world, in their local community. So these programs are who I interact with, and all of these fine folks from our unit, um, and Grace and other humans over in ODE. Um, yeah, so I love connecting with people and hearing about amazing work happening. I love supporting these programs. Um, I hope at some point the universe will, rain down some more money that for these programs to have, because what I'm hearing from them is their communities keep asking them, we need more, we need so many more things. Can you do so many more things? And, you know, funding is always an issue. So that's the wish. But yeah, that's me. That's what I do. I guess current projects. I think it's just, the projects that are going on. I don't really need to, go into a whole lot of things. I think it's just a lot of the work is around supporting the programs and making sure that they are aware of, good practices and things that they can kind of anchor to help them and validate them, um, with the good work that they do. So you can ask me any questions. If you want me to put my email in the chat, if you want to reach out and ever have a one-to-one or just kind of dive a little deeper, um, the fact sheets for both of these programs are on our website, so that could be dropped into the chat. You could look at that. So yeah, so, you know, these programs are just, you know, obviously kind of a small little piece of what's happening in Oregon. But it's great, and I'm happy to support them. And I see Connie has her hand up.
Yeah, I see. Thank you for share this. I have thoughts with all things I see. More because I hear from my community that how hard more in those remote areas to find and have the support with the kiddos and find the support in Spanish. I hear many times how they feel ignored from the school. And other thing, I hope one day we have a collaborative solving problems in Spanish, and the culturally approach with collaborative solving problems. And I think a lot of work to do, and more with other minor communities, because I see a lot of things like, can you back with the last, please?
Tamara.
The last slide
Yes,
with those
please.
examples, yeah.
Mm-hmm.
I can see Tamara's working on that right now. Give her just a minute to
Yeah.
pull that back up.
For the suicide prevention intervention, that one sometimes is so hard because I hear from parents and my own experience, when we try to find support for our kiddos, sometimes providers tell us, like parents, oh, I'm sorry if you don't want to receive support. Nothing to do. The law in Oregon says over 13 made their own decisions. I see this answer a lot when parents try to find support for kiddos, for youths especially. And I hope one day, like, work in the law need to be more specific that no applies with mental health kiddos. And that's why when they don't receive the support on time, later find other things like alcohol or drugs, because they don't find the support they need on time, because the law in Oregon says they made their own decisions. And I say that because I personally have that experience, and during I support other parents, I hear that many times. And it's so hard to hear, like, to parents' concerns and providers ignore because the youth doesn't want to have a counselor, for example, and parents are concerned. So that's why I say that, and we know we need a lot of work to do more in the schools, more trauma informed for those people work with those kiddos. And thank you for giving me the opportunity to share these things. Thank you.
Yes, and Connie, thank you for sharing. I mean, this is what this space is all about, is the opportunity for us to hear from you all about what is important to you and what your communities need, and what you need for your own children as well. So thank you. Yes, Casey?
I just kind of wanted to, like, ask a question or throw it out there. Doesn't have to be like a huge discussion or anything, but just kind of put it on the map. When it comes to like mental health in schools and stuff, one thing I've heard and came across myself too is when it comes to charter schools, and they, from my own experience and from other people I've talked to, seem to have a lot less resources. in those kind of situations when they're just like, we don't have like a school counselor, we don't have any type of Canvas support, just because it is like a smaller school. I know things are different when it comes to like charter schools versus public schools and all of that I don't know about. But I just kind of wanted to throw it out there to like not forget about the small charter schools when we're like looking at mental health help in school and the resources that are being given out to schools and stuff.
Yeah, thank you for naming that. I had a conversation with somebody on the Oregon coast, and I can't remember what county, but it was about exactly that. And like this funding is supporting like the K-12 schools, but yeah, I wish I could speak to knowledge around what's happening more in charter schools, and I really don't. So thank you for naming that.
Yeah, like I said, I was like, doesn't have to be super long discussion. Just wanted to throw it
Right.
out there to make sure that
Sure.
it's like on the radar,
Yeah.
not being overlooked kind of thing. Because
Mhm.
it's a very different situation when they don't fully fall under like public school things, but they
Mhm.
also kind of are, and they're a lot smaller. So you know that they can be easily overlooked. So just wanted to make sure that it was out there.
Yeah.
Thank you. And before we move on to Roxy, I want to call attention to some items in the chat. So Carol has shared that we need these programs permeating into the African immigrants and refugee communities. There's barely any support for Black children and young, I think they're supposed to say young adults related to mental health and addiction services. And then Bernardino, well, Kirk had shared parents should be included in their child's care, particularly when there are safety issues. Please go to the supervisor involved. And then Bernardino, in response to Carol, shared that funds from the SAMHSA ARPA grants in Bernardino's program just awarded $180,000 to African immigrant refugee organization to enhance SUD prevention services to youth and families. And then Carol had asked which organization this is, and Bernardino shared that it's ARIO, African Refugee Immigrant Organization in the Metro Tri-County area. And then Jenny has also shared in the chat that many disabled children end up pushed into charter schools. So I just wanted to catch us up on that. Thank you so much.
Can I say something about that?
Yes, please do. Yes, Carol. Thank you.
So when we talk about the African immigrant community, I don't know who these people are because I think historically, the Somali community has been considered the African community in Oregon for a long time. Somali communities are just a subsection of the African community. So whenever these grants are given as a ballpark to a community of African immigrants, truly, it is not getting to the people. There are very few people that get it, and they have access to many other grants because they come in through the Lutheran services as refugees. But how about this larger community of African immigrants, including the community I represent, that doesn't get these grants? We never get access to them. We see our children suffering from mental illness and not being able to get resources, but then we are told that this has already been awarded. I think there has to be a better way of reaching or of representation of what an African immigrant is or what a refugee is in Oregon, not just one name to represent everybody, because I don't know this community and I've been here a long time as a leader, but I don't know the people that work for this community and who they reach out to.
Yes, thank you so much. That's so important to note. And Bernardino's also shared a thank you to you in the chat for that too. And yeah, we can look at that, and I'd love to continue to partner with you on how we could do better in that work. Thank you for that.
Absolutely. Yeah.
Thanks, Carol. Okay. Any other responses to the chat before we move on to Roxy, who has had her hand? All right, Roxy.
All right, I gotta figure out how to put my hand down. So hi, I just wanted to chime in for a couple of reasons. One, so I'm a testing assessment child psychologist in the Portland area. But I used to be a psychologist intern that did a couple different days a week at an elementary school. And I've been in a lot of different schools in training. I'm a school psychologist. And my specialty right now is foster care. And I'm saying that because I've seen different sides of this. I've been a student that did, when I was younger, counseling. I have my own kids with some special needs. And so I get to see this from different angles. And professionally, I have a very privileged, in-depth understanding of the different dynamics that can go into school-based mental health services. I'm such a fan of having school-based mental health services for so many reasons, to be able to integrate mental health with the educational part, to have easier access to services, to not have parents have to worry about a whole different agency, to have teachers thinking about the mental health needs of kiddos by that collaboration. I also see the other side of things where I know a lot of kids that are super self-conscious or concerned about engaging in school-based mental health services because they see other kids going to the office. They don't know it's going to be shared, or they don't know if it's the same thing, or kids that are going through a lot and it's hard for them to have, like, if they're going through trauma or grief, it's hard to have that part of their school day. Other times where families really want to be involved, but it requires after hour like family sessions, and that I was able to provide, but not everyone is, and really integrating parents that way. Times where it was really nice because I worked at Morrison and I had a day at the school that I could pull them to the clinic. I could offer different hours. I could have that flexibility because I was integrated in the school, but not, that wasn't my whole like limitation to school-based stuff. And I also know a lot of kiddos, so this is where the kind of dynamics come into place with my role. Is what we do is these really comprehensive psychological assessments in general, but I also run the RAPID program, which is basically, it's an acronym, but it's all the mental health evaluations for kids entering foster care. And we get a lot of information, cognitive, psychological, academic screening, all these different things, and we pair a mental health recommendation for the kiddo. So sometimes we're saying things like culturally informed care, or somebody that represents their identity, or somebody that can offer support to the family in their language of origin, somebody who needs something like child parent psychotherapy, a trauma informed dyadic therapy, some kids that need something that is more like metaphorical, given some really significant needs, whether it is psychological or there's so much more of a visual versus a verbal learner, all these different things. And I have interviewed the schools. It's been a while because I don't have the time, but the last time I interviewed the schools with all the school mental health providers, I went through and asked, how many do you have? What are their representative identities? What languages do you provide? What modalities do you provide? And so that we could pair kids entering foster care with, like, no, oh, their school has school-based mental health services, but is that the right fit? And kind of really talking through the family of like, hey, your school has this. These might be the benefits. Talk with them about this. I'm recommending this. I want to make sure it's a good fit. If it's not the fit through the school, this is a local provider. We got to like weigh those. So all I'm trying to say is I'm saying that so that people can think about looking at these programs from the view of the actual mental health needs of the kiddos and the view of the families. What's the most benefit? Do families feel like they're being represented, that it's easy? Do they feel like because the mental health services is part of the school and they're having school challenges, or not feeling comfortable with the special education team, or feeling looked down upon by the teacher, like how does it feel to have a kid and your vulnerability of their mental health as part of the school system? How wonderful maybe is it that you get to not have to worry about transportation and can just talk, like, but really getting this perspectives of are my kids' needs being met? Do the therapists feel like they have the expertise for every kid that comes across their desk, especially when it comes to like trauma informed and neurodivergent informed care, culturally complex cases, all these different things. So I would hope that when looking at these and getting reports from these different programs across the state, that it is really area specific feedback and oversight and looking into not just the provision of services and how many kids are seeing and whatever kind of metrics they put out, but that feedback so that because it might not be able to get, I'm rambling, I'm sorry, but it might not be able to get fixed, but then like, are we just providing these services? How many like kids are we doing that? But like, are we providing the right mental health services? How comfortable is that for the families? How comfortable is that for the mental health providers? Anyways, I'm going on and on. It's just really complex, and I would hope that that be part of the oversight and data gathering.
Roxy, thank you so much for that perspective. And I think that really speaks to the difference in that quantitative versus qualitative data, right? And really gathering the stories and experiences and bringing that forward in that data experience. I want to give Fran an opportunity if you have anything that you'd like to respond to in regard to Roxy, and then I'd like to go to Grace next.
Yeah, I was just putting my email in the chat. I'd love to talk further if that's ever of interest. I just know, we probably need to move on. So I don't want to take up the whole meeting and take up the whole space, but yeah, there's some things that have been shared in the chat that I wish I could like unpack, with and talk one-on-one or whatever. So I'm just really appreciative of everybody's perspectives. So, and I'll stay on for another couple minutes if there's any other points, and then I gotta go, but thank you so much for the space.
Okay, awesome. Thanks. All right, Grace.
I think I'm channeling Fran right now. First, yeah, I think we could literally do an entire session on this, and I have so much I could say, and I'm also being mindful of time. I know you weren't planning on this being the entire agenda, because I know Jill and Shanda are here, and they have lots to contribute too. Yeah, first, just want to commend Fran, because Fran does amazing work, and I've been following along in Fran's footsteps in shadow for the last 4 years, and just want to name that. But gosh, there's so many things. Roxy, yeah, I'm a psychologist by training. I'm the director of mental health for Oregon Department of Ed, and so much of what you're saying I resonate with. And I think, there are a number of issues that we're facing, and I think that they're particularly acute in rural school districts that just have fewer access to resources, that don't have school psychologists or the luxury of time for assessments, or even when those assessments are done, the resources to point youth and families to, and Fran's work is incredible in that she is funding a lot of rural communities and communities that have needs. I think that as a state, this is a really a much larger systems level problem than something that's specific to the work that say Fran's doing or Jill and Shanda doing. I think that there's many things we could unpack in terms of this conversation, but one of the things that I wanted to elevate, and some of this was based on what I've been hearing from others here, is that even when a need has been identified, and even if you're in a school building where you have the luxury of having those services, the system itself is not often hospitable to youth and families. And so even if your kiddo has been identified as having a need, there often are no pathways or navigators for families, and they have to go into these systems and figure out how to get services for their kiddos. And that can happen in a well-resourced area like the Tri-Counties. I think it happens more in rural areas. And I'm just trying to find a way to get the charter school part of this into in a short period of time. I think this also applies to charter schools. So I just want to name that. But I don't think anyone in this room is not aware of the fact that we just, generally speaking, have a provider shortage in the state. And so one of the things that we are really focusing on with Fran and OHA and within our agency is looking to see where are the opportunities for really building strong linguistically and culturally responsive workforces within regions. And, with rural regions, that is even more challenging. I thought I saw something pop up in the chat. But one of the things that we've been focusing on in the last few years with a demonstration project that we're doing is really focusing on how can individuals within the communities be housed within schools. And in this project, we have folks we call community care specialists that are individuals within each school that serve as providing emotional support and system navigation for students and families within that school. And they provide everything from, I see Arden here, everything from socks to food to housing assistance to OHA applications to DHS links to McKinney-Vento supports, foster care. I mean, these folks are brilliant and they do it all. Hi, Aubrey, I see you. I know you and I have been in some of these meetings together. And so I think, you know, part of the solution is looking creatively at the system, and rather than saying, you know, master's level providers are the only, you know, the only solution for families, looking at, you know, peer supports, whether it's youth peer supports, family peer supports, et cetera, so we can take the burden off of the completely overtaxed, you know, formal mental health system and use other creative strategies that can provide support to families. Because, you know, I mean, I also have lived experience in the system, and I'm a psychologist and had a heck of a time trying to get assessment services and services to a kiddo. And I'm in Eugene, and Eugene tends to be heavily populated with providers, and it still was really difficult. So I think we have a lot of work to do. But the one thing I wanted to point out related to the charter school question, and I think this really does apply to other areas as well, is that one of the things we're focusing on in education specifically, because this is not typically how districts see themselves, is focusing on creating awareness within districts and education systems that they are part of local systems of care. And they are only as strong as they are connected with those local systems of care, whether it's food, again, all the things, right? You name it, everything from socks to food to shelter. A lot of those needs are needs that when they are met, they reduce the stress for families. And in reducing the stress for families, they're also reducing the mental health burden. It doesn't mean that there aren't, you know, kiddos and families that need more services, but it means that when districts see themselves as part of a network, they have much easier access to services than they do when they're standalone entities with not enough staff to fulfill the need. So always willing to have this conversation. I think I've said enough, but yeah, there's hope and there's a lot of work to do.
Thank you so much, Grace. Those are all really, really good points, and I just so appreciate you sharing all of that context. I want to bring attention to Roxy's chat, and then we'll go to you, Bree. Roxy shared 100%, and rural needs represent a much greater complexity. I just hope the needs and challenges are identified, even though services are not available. So we as a combined system can understand where and how much we are lacking in some areas, even if we don't have the solutions yet. I am going to give our conversation, give or take another 5 to 10 minutes, because I know that Jill and Shanda are okay with that. They've shared that in the chat. And so we'll do that and we'll take a break. Bree.
Yes, hello.
Hi.
I am Bree. I apologize if it's noisy. I am at the Prayer Center currently. I would like to share what I'm trying to do with the local soccer league in Malheur County, and also the local LCHIP here as well. I am working on trying to, as a family rep, get community partners to back us on trying to get a fundraiser going to get a family drop center here. And I feel like it's a good first step towards trying to get people advocating and getting resources here in rural communities like ours, to show that, you know, hey, there is high needs, and maybe get some of those providers and stuff that are thinking that they can only help in like places like Portland and stuff to these more rural communities. And I actually got told by the CEO of Lifeways here that he would like to do a one-on-one with me and talk more about this. And I'm super excited. And I'm hoping that the more that I just keep talking about these things, the more that other places will, and other communities like mine will start trying to bring these resources here, because I feel like in rural communities, the resources that come to helping families are neglected, and that there's so much that could be done if we can start off by getting family drop centers and other things to help people, like day treatment programs in the schools, and all these other wonderful things that could help families, so that, you know, families like mine aren't having to go through the struggles with CPS, or having to have your child sent to Portland to get help, because it is really hard. And I look forward to keeping you guys updated on how this goes. So far, my idea for a fundraiser is to have a family fun day carnival. I'm hoping that I can get Harney County, Nissa, Ontario, Vail, all involved in this. And I'm hoping that this will give a lot of the families that are like mine, that are struggling, the chance to feel heard and have a voice, and maybe give them the courage to advocate for themselves too, so that we can get more family reps here, because currently for the local Sockawee, I am one of the only family reps. And I am hoping that, you know, if I just keep saying these things, maybe other people catch on to it and it'll become a thing, and that we can really get the ball rolling on these things, because I know that these things take time, but I do believe that the more that we advocate, the more that we can help the system get better. And I'm just so happy that we're talking about these things. And I was so excited to be able to share all these things that I'm working on, because I felt like a lot of the times in these conversations, I don't know when to put my input in, or like how to navigate these conversations well. But I really felt like this was a chance for me to be able to articulate myself well, and to be able to get the voice out there, because the more that you keep advocating, the more that you will get heard. And I know that it's hard. I know that it sucks. Just keep coming. Just keep advocating. It's going to work. I never even thought I was going to get this far. I'm so appreciative of all the people that have heard me and heard other families like mine and are trying to help. And I wouldn't be where I am if it wasn't for systems care. And I'm so thankful that I can do this on a local, regional, and state level now. And I'm so happy that I can help other people.
Bree, that is totally awesome. Thank you so much for sharing that. You just exude passion and advocacy, and I'm just so thankful that you came to us and shared your voice today and told us about your amazing project. This really speaks to kind of what, you know, Grace was saying about having that peer support kind of embedded at the levels that we need it to be, so that families can have that immediate access. So I'm super excited for you. I'm so happy that you got your meeting scheduled, or that they've reached out, and we definitely look forward to hearing more. Thanks, Bree. All right, Carol, and then we're going to move on and take our break after that. Carol.
Yeah, I just wanted to kind of highlight the systemic issues related to the delivery of mental health services. And I think the fact that it's, you know, the mental health delivery services are built on a mainstream system. I don't think there is a lot of cultural dynamics that were factored into how people should receive mental health services. And I think as we talk through this, it's important for us to know that we have had many different cultures move into Oregon. Oregon was previously, for a long time, very mainstream, I would say white in nature in terms of the way people receive care. But since there's a lot of movement of people in this state that are people of color, the way they receive mental health is different. The way they look at mental stigma is different. And I think we have to start to think outside of the box about how do we support these communities that may not necessarily be comfortable going to an office and talking to someone for 45 minutes because one, they lack the lingo and an ability to express themselves in a way that makes sense. because it feels like a performance versus feeling like it's a healing session. I have to feel like I have to have the right words for me to be understood. I have to put on a posture that makes sense to the therapist. And then I'm finding someone that doesn't understand the cultural dynamics and the trauma that I may have gone through. And then, so that's why I want to present an idea of diversifying the delivery systems of mental health and providing opportunities for communities to organize their mental wellness and support. I myself, as a community leader in my own community, I feel like I work for a call center. I'm always receiving calls, de-escalating, praying for families, supporting, visiting them because they're experiencing a crisis. But this is how they know how to receive mental wellness. This is their way of receiving it. But then I'm like, how can this be factored into the systems of care so that I'm not feeling like I'm a constant volunteer person providing support for Oregonians, but it will never be documented anywhere.
So important, Carol. Thank you so much for saying that. And we do have work to do in this area. We absolutely do. So I just really appreciate and value that you're open to sharing that. And thank you for collaborating with me behind the scenes. And I look forward to working with you further and partnering on how we can further this work.
Thank you so much.
Yeah, thank you, Carol. All right, Fran, thanks for sticking around. If anyone has any other questions for Fran, Fran has put her email in the chat, and we are going to go ahead and take our break. I will drop that funny video in the chat as well for people who want to watch it. And let's be back at 11 o'clock. Thank you. We'll see you in a bit. If you wouldn't mind lowering your hand, Carol, just so I'll thank you so much. That way I'll know if you have a future question. Thank you. All right. Well, we are going to go ahead and shift gears and give time to Jill and Shanda to tell us about the work that they do within our OHA Child and Family Behavioral Health team.
I'm not sure Shanda is back yet. That lady loves her breaks to the nth degree. Also, she's sharing our slides. So
well, that's important.
I'll get started. And oh, hi, Sophie.
I'm here. It's just our daycare flooded today, and so Sophie is home, and my partner has physio right now. So just perfect.
Perfect timing.
Sophie, everyone.
Hi, Sophie.
He's having a sucker.
Hello.
Babies are welcome. We are talking about children and families, so.
Exactly, right?
Do you want me to share slides?
Pets are also welcome.
No, I will share slides because it's easier that way, because that way if you lose smooth internet, we will still keep going.
All right.
Okay.
Excellent.
And
I'm going to start with introducing myself and then lob to you for the game. Is that okay?
Sorry, pause. Can you see the slide?
It's the whole thing.
The whole thing. Let me try again. Start.
Thank you for letting us be here. My name is Jill. I use she and her pronouns. This is Shanda. She also uses she and her pronouns. We together do youth suicide prevention, intervention, and postvention programming on the Child and Family Behavioral Health team. we are going to, after introducing ourselves very briefly, we're going to play a game in which we're going to ask you to turn your cameras on. So prep yourself for that. If you need to comb your hair or pretend, I don't know, so, like put the Zoom filter on that puts your makeup on or that type of thing, whatever you need to do. We still see your whole screen, Shanda. There we go. Perfect. My name is Jill. That's my family there on the right that you see in your screen. I come to this work from the world of school counseling. So I was a school counselor for 10 years, grades 5 and up. And then I did restorative justice and juvenile justice before that. I'm a person with lived experience. I have had 3 seasons of my life where my brain has had thoughts of suicide that I needed to get the right help at the right time. And I have a brother and a daughter who are suicide attempt survivors. My family is big and chaotic, and some of them are here today because our spring break started today. I have been a part of this team since 2019, so I'm knocking on the door of my 5th anniversary at OHA. And yeah, I feel privileged to be in the seat, getting to do work that matters for both my head and my heart, for my babies and your babies and all the babies. Shanda, do you want to introduce yourself?
Hi, I'm Shanda. You can still see the slide, even though my chat box is sitting in front of it. You can, okay. I use she and her pronouns. I'm with Oregon Health Authority, as you know, with the child and family team. You can see my offspring there in my family picture. We are also a herd, though not as big a herd, but it feels pretty noisy most of the time. I'm a social worker. That's my background. I was in schools before this job. I've been here about 4 years. And before I was in schools, I was in healthcare. Yeah, I love being able to be a part of the solutions. I love being able to think creatively about how we make systems that work and support local efforts and get barriers out of the way. And it's been a fun pile of work. So, and thank you all for making space for us. So we're going to start by playing a little game that does require screens on. So I know that that is not always the norm for all y'all in this meeting. So if you are in the car or you don't like your own face, or you just are in a space where you don't want to turn your camera on, that's okay. You can still play. It's just not as much fun if we can't see your responses. So if you can be cameras on, and if you're like, you know, folding laundry or stretching, that's okay. We accept. So we're doing this just to kind of shake things out and get us, you know, get some cobwebs out of our brain. Not that we grew cobwebs off while Fran was talking, we didn't, but I'm going to say a topic, activity that is fairly insignificant, but derives strong feelings for a lot of people. And you're going to indicate on your in your Zoom square whether you love that thing, yes, please, that's great, or no, thank you, hard pass on that thing. Okay, and so then your opportunity is to, and actually, I'm going to stop share, even though because that won't work, even though it might get bumpy going back on. So no, thank you. Yes, please. Okay. And if you can't be camera on, you can still do that, and you can look and see who on the team here is with you. Okay. Starting off with a tough one, mayonnaise. No, thank you, or yes, please. Oh, interesting. Okay. Next one, talking during a movie. No, thank you, or yes, please. Oh, okay, good mixed crowd on that. Christiana can decide. I appreciate that. Okay, Not controversial, I don't think. Naps. Are there anybody? Oh, see, we can all agree on, oh, yeah, sort of ish. All right.
Crazy's undecided. I have so many questions for you.
What is a nap? I've never, you know.
Oh dear. Okay. Cilantro. Yes, please. No, thank you. Big feelings, big feelings. Okay. Cleaning as relaxation. All right, we'll do one more. Also, I don't think controversial. I think we might, I'm gonna see, I'm hoping we might all agree on this one. Betty White. Okay, pretty close. Good work, everyone. Thank you for indulging that for us. I will go back to sharing my screen so smoothly. You will all think that I was just born on Zoom. I wasn't. There we go. Thank you. We are going to move into talking about suicide prevention, specifically youth suicide prevention. That is what Jill and I do. We talk about this all day long, every day, sometimes even on our days off. So we are always in this space. You are not. And even those of us who are always in this space, sometimes, like, this is a heavy, heavy topic. And even for those of us who sit in it all day, sometimes it shows up in a big way. It takes my breath away, the tears show up, and it punches me in the gut. So I'm just naming that is normal if you feel that happening for you. And what I do when that is happening, I try to take a pause. I take a drink of water. I sometimes move my position in my chair, feel my feet on the floor, maybe slide forward. I love a good stretch. So do what you need to do to take care of you in this moment, knowing that we're going to be talking about something that has affected probably every single person in this room. And if today is not the day for you to be hearing about this work, that's okay. You do not have to be here. You can mute me and walk away if you would like, and I will not be hurt. We are here always, so we'd be happy to catch you up later if today is not the day for you. But we are going to be talking, we're going to launch into talking about the data. We're going to start there, and then we're going to talk about the programming work that we're doing. For many in this room, we see you in lots of spaces, so this will be a little redundant, but there's also folks in this room who we don't get to see very often. So we're aiming this toward you all that we don't get to see very often. We're going to start with the data. The data is not perfectly collected. It is grown out of systems. You hear the toilet flushing, perhaps. Sophie is just flushing the toilet in my nearby bathroom. Just in case you can hear that. The data is not collected perfectly. It is collected in systems that were built imperfectly and intentionally so in many cases. And so we just name, as we know it is important to use the data to inform our work, and we know that the data is imperfect. And so alongside of sharing the data, I want you to know that we are working constantly to push the data to be better, to be stronger, to be more inclusive. And so with that caveat, we're going to launch into talking about the data. And I'm going to mute myself.
Thank you, Shanda, for that. We wanted to start with kind of the broad overview of what we know for right now, which is that youth suicide in Oregon has been above the national average largely since we started tracking in 1999 on charts, although it has been confirmed by an office purge recently that somebody wrote it down on paper in like 1984. So that's exciting. Youth suicide in Oregon continues to be above the national average, even though, as you can see, In 2019, 2020, and 2021, Oregon has experienced decreases in youth suicide deaths. This data is, the 2021 data is right now the most finalized data that we have. We're going to talk a little bit about what we know about 2022 and 2023 preliminary data here in a minute. The difference between the finalized set is that this finalized data comes from the CDC, and it takes into account all of the state's information. So right now, when we're talking about our preliminary data, we know about our data in Oregon. What it doesn't account for is if a young person dies outside of our state that we might not have knowledge of. So the distance between the preliminary data and the finalized data is usually between 1 and 3 deaths that aren't represented. This is cause for celebration and on one hand, and on the other hand, it's a clear mandate that Oregon needs to do better. This chart shows the number of suicides among youth 24 and younger by race and ethnicity. Like Shanda said in her kind of preamble, race and ethnicity data is flawed. So this is as best we have with flawed data. And you can see that while the total number of youth suicides, which is that bottom row, in 2018 was 127, that number fell to 92 in 2021. And that you can see that it is largely because of a large reduction in non-Hispanic white youth deaths. That if you add up all of the other race and ethnicity categories on this chart, that the number remains steady from 2018 to 2021. Both of those numbers equal 31 deaths. And so we have been operating and will continue to operate under the pieces of knowledge that two things are true, that we have reason to know that something that we are doing is working, and it's not working equitably across all race and ethnicities. Next slide. All right, this is a weird chart, but it represents something I'm very excited about, because this is the most recent data that OHA has. It's the preliminary data, and it's something that we haven't been able to share with this level of specificity ever before. And so often on the reports, it'll say like, based on preliminary data, OHA doesn't anticipate a increase or a decrease for the following year. And so now we get to be able to talk about what those numbers actually are. And so, Shannon, will you go back one slide? Sorry. So from the peak, 2 slides, sorry, one more. From the peak of 2018, that represented the highest number of deaths in Oregon by youth suicide. That's 127 deaths. And then 3 years of a subsequent decrease. What we know about 2022 is that that we will not see a decrease in youth suicides in 2022. In fact, the number goes to around the same as the 2020 numbers. And so it's still a part of a decreasing trend, but it is not another decreasing year, if that makes sense. So we have not returned anywhere near to the peak of 2018. But we won't see an additional decrease in 2022. And what we know about the 2023, you can stay here, Shanda. What we know about the 2023 numbers is that they're nearly identical to 2022. So so we have a bit of a, so we know that we're not increasing or decreasing in 2023 based on the preliminary data. So I'm going to pause there just to see if there are any questions around that piece of it, knowing that it's heavy and convoluted, and want to make sure that the way I said it sounded like a way people can hear it.
May I ask where this data is drawn from? Is it from the hospital reports or?
This chart shows from the CDC. So this is the finalized data chart. the CDC gathers data from the violent death reporting system. So that system feeds into the CDC, and then they can issue all of the state's data. The Oregon Violent Death Reporting System is what this data shows. That's the ORVDRS up top. That it takes into account death certificates, medical examiner reports, and law enforcement reports. So they review the three of those before they have they show up here. Kirk?
You can go back to the slide that starts with 2018, 2019 in terms of ethnicity. 2018 was such an outlying year and our worst year, and the data potentially are misleading. It would be nice to see the data before 2018. Certainly you demonstrate a decrease in non-Hispanic white, but it starts with 2018 as being the worst year. So it would be helpful to have data before that. Can you provide that to us at some point?
Yeah.
Thank
Yeah, we're so the annual, this chart has never been in our annual report. We asked for it because we wanted to look at it with this lens on, and so the intention is to have race and ethnicity in the annual report from here on out. So but do you have a year that you'd like us to go back to?
I'd probably say 2015.
Okay.
That'd be helpful. I think the long and short of it, and it's so good to see the improvement, and we want to see improvement in all ethnicity and race. That 59 is still a high number, and still the bulk of the deaths. And while there's improvement, one death is one too many.
Yep.
So that'd be helpful. Thanks.
Yep, absolutely. Tamara, would you be willing to put that on the tracker thing and assign me to it for data by race and ethnicity from 2015 forward? All right, let's move now. So one of the things that we wanted to start to kind of just give a level set of where we're at with youth suicide prevention, knowing that a ton of work has happened between 2019 and today in your communities and around the state, that we have a beautiful network of champions for suicide prevention in every corner of our state, and something that we're doing is having an impact. We're not accepting it as victory, or that we're not done. We're not taking our foot off the gas pedal, but that it is important to pause and celebrate, because in this work, there aren't always moments to be able to say like, okay, something that we're doing is having a difference and making a difference. And we have miles to go in 100 categories. So hear that loud and clear, that we're not, we're asking for a deep breath of celebration and then get back to work, essentially. One of the things, and Shanda's going to talk through kind of a bit about programming here in a minute, but one of the things that we wanted to pause in as we transition away from the data and into what we're doing about the problem of youth suicide, is to invite you into this activity. So Sources of Strength, which is what this wheel represents, Sources of Strength is one of our upstream primary prevention programs that we make available in K-12 schools and college and universities and other youth serving systems. It's excellent. It's so good. When I was a school counselor, I got trained as a trainer in this program, and have been a fan of it ever since. It's the best suicide prevention that there is. And it's good for all of us, because turns out youth suicide prevention and adult suicide prevention aren't, you can't tease those out. That if the adults are well, the children have a better chance of being well as well. Too many wells. So here's what I want you to do. I want you to look at this wheel. These represent 8 sources of strength, 8 ways, 8 moments where we have the opportunity to get stronger, to lean into exercising our muscle of hope, and to lean into wellness. So one thing that's important about this to note is that our programming, the suicide prevention programming, is not therapy focused. That mental health is one of the wedges of this wheel, and therapy is one piece of mental health. But that the strategy for youth suicide prevention is much broader than focusing on therapy alone, but rather as therapy as a piece of a very large, beautiful puzzle of strength. So I need to take, we're going to give you 30 seconds to think. Look at this wheel, which is available. Shanda, will you find the different languages link and put that in the chat as well?
Yeah.
It's available it's free of charge. You can find it without, not behind a firewall or paywall. But we're asking you to look at here and find 2 areas that you feel strong in right now and 1 area that you think you need to strengthen, and then invite those responses in the chat. So, and I'll just model what I mean. So for me, I recently got back on the kind of anxiety medication that works for my brain. So I'm going to say that is a mental health strategy that I feel strong in at the moment. I also feel strong in spirituality, that I have a faith community that feeds my soul in a beautiful way at the moment. One area that I feel like I need to get stronger in, I'm going to say healthy activities. I used to like run and walk with great regularity, and that has fallen off in the wetness of winter. And so healthy activities is the area that I'd like to get stronger in. So I'm going to stop talking here, and I'm going to ask you to put in the chat 2 things that you feel strong in and 1 that you might need to strengthen. Somebody says 2 areas of strength are family access and medical access. 1 area I need to grow on is having positive friends in person for real life connections. Another person says I'm doing well with healthy activities, swimming, walking, naturing. That's a lovely verb. And generosity, I want to nurture more within my friendships. Another person feels strong in medical access, positive friends, needs to strengthen mentors. So fun fact about mentors for young people, that if a young person has a trusted adult they can name in their life, that has a strong correlated effect to their risk of suicide. And so 1 trusted adult greatly reduces a young person's risk of suicide. 2 trusted adults statistically eliminates the risk for suicide. Doesn't mean that they won't have suicide thoughts, but it's incredibly protective. And it's a thing that's bidirectional. So the relationship between a young person and a trusted adult is beneficial both for the young person and the adult, so that there's increased strength and mental wellness both ways for that. A couple more. Person feels strong and positive friends and mentors, needs to strengthen healthy activities. Family support and spirituality are strong, need to strengthen mentors. And another person is strong in medical access and mentors and needs to work on or getting stronger in positive friends. So thank you for participating in that as we transition away from the data and into what we're doing. And we'll go to the next slide. So don't try to read this. It is not possible. So don't do a thing that you will that is not possible. Shanda can put to link this in the chat and we can follow up. I think it's clickable in our slideshow as well. But Oregon has what we call an Oregon Suicide Prevention Framework. That's important for us to have you know exists, because all of the work that we do, all of the activities that we and projects that we pour money and time and love and energy into fit into this framework. The green section is and so it gets from very broad to very specific as you move out of the framework. Everything that we do tucks into the pathways and the goals of this framework. And so So just knowing that the green section or that top section is universal strategies, things that we want all people in Oregon, all children, family, adults, older adults, to be able to experience and have available to them. The yellow section is selected. So these are more kind of specific places and spaces and strategies. Here's where a lot of our training is, safe storage and programming that's specific to populations that might have an increased risk of suicide. And then the orange section is treatment services. And so that's after suicide risk has been identified. How are we caring for, treating, helping somebody heal from suicide? And then our post-vention response after a suicide death, those activities are also in that orange section. All of these sit on a foundation of policy, funding, data, and evaluation that we can have all of the good ideas in the world, but if we don't have the policy support behind it and the ability to pay for it, and we know it's working, it's not something that we're gonna keep breathing into. So just naming that exists. This plan is called the Youth Suicide Intervention and Prevention Plan. You might hear the words YSIP and ASIP in the world of suicide prevention. The YSIP is the youth version, the ASIP is the adult version. This plan is the second iteration of the plan for statewide plan for strategies to prevent suicide in Oregon. It outlines what are the annual initiatives, what are the annual projects that we're going to work on to make more progress in suicide prevention. So each year we ask the Oregon Alliance to Prevent Suicide, our state agency partners, our advisory groups, what's the next right step? What do we need to start, stop, and continue in the next year to further our progress in youth suicide prevention? Just naming that it's a lot, so I'm not going to go through those, but so in 2023, there were 160 projects or initiatives that we worked on, that we funded, that we asked our partners to believe in. Actually, go to the next slide. I think it shows it better. So in the annual report, you'll see that for 2023, last calendar year, 86.5 of our initiatives were on track. We had good success. We were where we wanted to be with the projects themselves. About 11% of those 160 initiatives had barriers. Either we didn't get the funding we needed, there wasn't bandwidth for it, or we couldn't figure out the bureaucratic schmozzle. So there's like different areas of what represents those 11%. And then, like I said, at the end of each year, we ask ourselves, what's the chiropractic adjustment that we need to make to the YSIP list? What do we need to start, stop, and continue into 2024? And as a result of that process of asking our partners and doing that assessment, about 2.5% of the 2023 initiatives were determined not to be priority for the next year. Next slide. Oh, I didn't put in. So just as a level set, in 2024, there are 189 initiatives on the 2024 list. The reason for the balloon in number is because we asked more of our state agency partners and more of our internal child and family behavioral health partners to name specifically what they were doing for suicide prevention in the next year. And a lot of that for the children and family behavioral health team was a result of CSAC, of this committee saying like, here's the next right step for us in the broader system. So, so with that, I will be quiet and pass to Shanda.
And the link to the 2024 initiatives was in the chat there. So, yeah, you're welcome to peruse those. Kirk, do you want to chime in now, or yeah, go ahead.
Yeah, Jill, appreciate your presentation. As we look to steps moving forward, it sure would be helpful to have data that OHA collects related to gender and deaths by suicide. Maybe you can speak to your knowledge of what the OHA data speaks when it comes to suicide deaths and gender.
Yeah, and first I'll start, thank you for that question. First, I'll start with naming that death data is one piece of the puzzle that we look at when we ask ourselves, how are we doing with suicide prevention? We also want to make sure that we're paying attention to calls to 988, paying attention to visits to emergency departments, paying attention to who is receiving services, crisis services, or outpatient services. And so the death data is just one piece of the data that we look at to answer the question. It's just the data that people are most interested in the typically in a first pass. So naming that Oregon's data collection is definitely flawed in both gender identity and sexual orientation, that we have we're on the cusp of being able to get better at that, of reporting data around sexual orientation. That it'll take a second to get gender identity in line with what would be able to tell an accurate story. Because right now what we have is a binary male or female or unknown option, which doesn't accurately reflect the young people that are in our state. So with all of those caveats, that Oregon is not different than any other state in the nation, that when you look at suicide death data, male identified, or what we know to be male identified, young people are 3 times more likely to die by suicide than females. And that data flips when you look at attempts, that females on average are about 3 times more likely to attempt suicide than males. And so the disconnect there is, the theories are, the disconnect is largely around what means that the young people choose to attempt suicide, that males typically or stereotypically tend to choose more lethal means.
Appreciate that. It really does seem like, given that 3-to-1 regarding deaths, and that's ultimately what we're here for, is preventing deaths, an important focus for this upcoming year.
Yeah, and we we can talk about this too, but the disparities in our efforts are around race and ethnicity. That the amount of progress or reduction in youth suicide deaths for males and females have remained steady, that ratio has remained steady. And so something that we're doing for all Oregonians is working at about the same rate for males and females, for what we know for males and females identified folks, but that it is not necessarily true, or it's not true when you look at race and ethnicity. So we are all here to prevent suicide. I think that's the part we'd like to land on. With that, I'll lob to Shanda.
Yeah, so we're going to spend a little bit of time talking about some of our program work, some of the things that we've stood up statewide. Some of them have been around for a little bit, and some of them are brand new, just getting their sort of Bambi legs underneath of them, you know, like Bambi the movie when he stands up and he's so we're going to start with the Big River. I hope that this is not brand new for most folks in this room. When we received state general fund for youth suicide prevention in 2019, we invested some of that money to build a statewide menu of suicide prevention programming that addressed both upstream prevention, intervention, and postvention, how we care for a community following a suicide death. This is that menu of programs. When you get this slide deck, this is clickable, so you can go to it, but Jill also put it in the chat there. All of the programs are clickable on this graphic, so you can go and find out who are the human beings who are coordinating this program across the state. How can I connect to this program? And also on the new flyer, you don't see it on the screen here, but on the new flyer, there's a link underneath where it says connect. There's a link that says, what training should I take? because we don't want anyone to hear that they should take all of these trainings. You'd be spending the next several months of your lifetime in trainings, and they would all be excellent, but I think you probably don't have that bandwidth. So please don't take all these trainings, but do, if you want to figure out which is best for you, Jill actually linked them in the chat as well. And that's a chart by role, which of these trainings might make sense for you. All of these trainings have a human coordinating them. All of them are excellent. There are lots of other trainings out in the world. The suicide prevention training realm can get very, very noisy. And that's part of why we put this together, so that every county, every school district wasn't figuring out which ones should we invest in. And we tried to say, like, we could leverage state dollars to make these cheaper for local areas, make them no cost for local areas as much as possible, and help them cut through the noise of all the opportunities out there. These, you don't even need these QR codes because we put the links in the chat. In addition to that programming, we know, so we have, that programming's been stood up now. We actually have that same flyer in Spanish that, I don't know, Jill, I didn't follow the chat if you linked both. If you change the E to an S in the Big River link, it changes to the Spanish flyer, if that makes sense to you. And we've been working on, like, we have seen from our data around this time last year is when that data came out that Jill talked about, that made it really clear two things are true for us. We're making some progress. We're not seeing the same trends as the rest of our nation. And it is also true that that is not showing up for kids of color in the same way it is showing up for white kids. And so that mandate really amped up for us what we already knew we needed to be doing, which was centering equity. And we'd already been working on that, but we went after some extra funding to be able to really infuse into that work. And so from some really great partnership with SAMHSA and with folks out in the community and with leaders in our counties. We have recently, led by Deshanta Kim here at OHA, we have a fairly newish coming together, a Black Youth Suicide Prevention Coalition. This is the team of people that went to a SAMHSA policy academy to begin building that here in Oregon. So that is standing up. We went after some federal money to give that group of folks actual money to do some work, because you stand up a coalition, but if you've got no funding, it's hard to do much. And so that group of folks is hard at work. They are getting youth, they're pulling together youth to direct the work of that coalition in a really exciting way. And if you'd like to know more about that, Deshanta is an excellent human to connect to, but you can also email Jill and we'd be happy to connect you to that work, because it is emerging and it is really beautiful. I just was about to say next slide, and then I realized that's me. Another piece of that work is our Life Sustaining Practices Fellowship Program. We've partnered with Dr. Kendris Watson, who has just like super interesting background, and some of it is captured in this video that is linked here, called If These Cells Could Talk. And his work along with Dr. Tiffany Marie, they've spent work looking at this really interesting telomere study that I cannot fully even, it's so interesting. It's captured in that video. And what they did was looked at college going Black young men and how their bodies were aging differently. And it is so exciting. And we saw the work of Dr. Watson and Dr. Tiffany Marie and reached out and started talking with them about what could we do to build on that in Oregon, and how could we bring this knowledge into the suicide prevention work. And so that grew out of that conversation grew the Life Sustaining Practices Fellowship Program, which is now underway. And we have fellows in Oregon who are working with Black youth across our state and going to be addressing suicide prevention and racism-based trauma, like healing through that, as we wrote down here, as through consciousness, cultural, and ancestral wisdom. And then from that, going to develop a framework that we can then replicate in suicide prevention. It's very exciting work, and it's part of that BMB work. Like, it's just getting its legs just getting stood up, and honestly, I get kind of giddy when we talk about it because it was a lot of years in the making. And even more years if you're Dr. Watson and Dr. Tiffany Murray. Other things going on in our state that you should know about and be excited about. We have a really strong Oregon Alliance to Prevent Suicide. I would guess that many of you have been in that space. That is a group of people. It's led by the AOCMHP. My brain doesn't work.
Association of Oregon Community Mental Health Programs.
Thank you. And they meet quarterly as a whole body and monthly with several different work groups and committees. There are lots of ways to get involved with that body. They do policy advocacy. They gather youth voice. They do community work. They support local coalitions. Lots and lots of good work happening. And all of this infrastructure that we're talking about, all of the work that we're doing is really due in large part to the work of the Alliance, who gathers what's going on in our communities and then how can we move this work forward in Oregon. Because as you all well know, in a state agency, we can do a lot, but it doesn't mean a whole lot if we're not connected to community and if we're not being led by what's going on in the community across Oregon. And we are very, very lucky to have the Alliance leading that work. All right, well, no, we could keep sharing. We want to make some space for questions, and then we had a few questions we wanted to ask you all. If you have questions from our work, and there's so much going on that we may not have even touched on a thing that you're like, I've heard about this, or I am wondering about this whole other bucket of things. Please ask those questions. And then we have a few questions here that we would love to hear from you all on around where connection and belonging have shown up for you. Because at the end of the day, suicide prevention is connection and belonging. And so that's the thing that we want you to know deep in your heart of hearts, is that, yes, we want you to get trained. Yes, we want you to be equipped to help young people connect to help. We want young people to be equipped. And we want to take care of communities after a suicide death, all of these things. And at the end of the day, it's connection and belonging. I see that we already have one question. I'm going to take this slide down for just a second while we talk, because I would like to see your faces, those that are able to share their face. And some really nice artwork in your Zoom squares. So if you have questions, now is the time, and then I'll copy the questions we have for you all into the chat.
Perfect. Casey, go ahead with your question.
Okay, it's kind of a question, comment, I don't really know. Also, I want to start before I say this, I've been trying to think of how to say it in my head, and every way I'm coming up with it sounds kind of like rude, and I'm really sorry if it comes off that way because that's not my intention. But when we were talking about earlier, and you were talking about like mentors and how they were super important, especially like with kids, something I've seen a lot, both in like my professional world and personal, is the lack of any type of mentors. I'm a family support specialist with Trillium, and something that families have asked when kids are discharging is some type of mentor for them to have outside that's not necessarily therapy based, and things like that. I also have a young son that I've looked into some kind of mentor for and have not been able to find anything. This is where I'm like, I hope it isn't like, I don't want this to be like rude or question. Is there any type of program that is in play or has been in play or might be in the future to help with some type of like mentoring program for kids and teens and stuff?
Wow,
Makes
rude.
sense. I was like, I feel like being like, where's the program for this? Like, I was like, I'm not trying. I was just like the whole time I was like, oh, that sounds really mean in my head. And I really hope it doesn't come off like
No,
kind of thing. So
not at all rude.
okay.
No, and I think that's a great question. I don't know. And so if other folks in this room know of a statewide program that is doing that, toss that in the chat or unmute and chime in. I don't know of a statewide program for that. I would, I know of a few in like the Albany, Eugene area. Ophelia's Place does some of that, but I would also encourage you to think about, because really I think we often, like a program would be great, but I think we often get blinders on and think it needs to be a program or a thing I sign my kid up for. And the reality is that any adult can be a trusted adult. And and we talk about this in lots of spaces, but sometimes there's a school janitor that is like a really great trusted adult that kids just gravitate towards. So I think thinking about that, are there any organic adults in your kid's life that your kid is gravitating towards? And reaching out to that person saying like, hey, you seem to be a person my kid trusts. Is it okay that could you, I want you to know that for one thing, because I think when adults know that, it's like, oh, and they take that role as an honor. I mean, I think most adults do, especially folks in those like non-traditional roles where they might not have even realized like, oh, your kid sees me that way. That's great to know. And to sort of lean into those organic things that show up in your life. And I know there are moments where our life feels like a desert of those humans. And so I don't mean to suggest that like, surely, but I think that's one piece that I will say is keeping an eye out, and maybe even asking your kid, like, who are the adults, and kind of pushing them, because I know most teenagers, their response like, no, get out of my room. Teenagers are also lovely, but as somebody whose kids are little, I know that, whatever, I'll stop talking about that. But I think I'm all of that to say that I think that there are adults out there who, when they know that there's someone your kid looks to, would be honored to step into some of that space.
One of the other like tangible, oh, go ahead.
Oh, I was just gonna say, I love that you said janitor, because that was literally like my kid's like biggest support person for like 2 years was a janitor at his school. Like in his IEP, they went on breaks together.
Aww.
It was like the biggest support person for my kid, like outside of family. He left the school this year and went to a different place. But yeah, like I was able to find someone for my kid that literally works at the Dutch Brothers that I go to the most, that my kid thinks is super cool. And he was like, yeah, I'll hang out with your kid and like, we'll go play basketball. But I just feel like when I'm looking for families, like with a kid discharging, so I'm like, I don't know who you're seeing. And like, I don't know their personal life and stuff, but just trying to find things like big brother, big sister, or things like that. I found a few randomly throughout Oregon, because they discharge all throughout Oregon, so it's not one place. So I was just figured this was a good place to be like, hey, does anybody on here know, like, hey, here's this program that kind of connects all through Oregon. So
so I would just affirm the like approaching an adult and naming them as their trusted adult and asking for that to be kind of a little bit more solid. And it doesn't have to be something very structured, even just to know that you've got some people in your village for your kid. the other thing is sources of strength. There are programming and sources of strength in middle and high schools do have adult advisors in that programming that have signed up to say that they want to be involved in a kid's life. And a part of the sources of strength programming is naming a trusted adult and finding a trusted adult if you haven't. And so we can put some resources in the chat too around sources of strength at home, which can be used in like anywhere. So I would use it as a mom, but I would also use it as a school counselor if I was looking through the packet. So we'll find that.
Thank you.
I don't see a question in the chat, Christiana, and then there's two hands up. Do you want to moderate?
First, real quick, I thought Shanda was asking us to answer that question in the chat. Or maybe just think about it. Shanda, can you provide
you don't have to. It was if there weren't questions. So we can go to Abri.
Okay, Abri. Thank you.
Okay, I'm gonna try to word this the best I can. So I apologize if it comes out wrong. I don't necessarily agree. I feel like when you're dealing with a lot of stuff and you have high needs children specifically, because I feel like that what she was saying previously, kind of regarded like when your kid's like getting discharged and stuff, it kind of seemed like it was a high needs situation. So apologize if I assumed wrongly ahead of time, but I feel like it would be more impactful if like we could figure out ways to like get like youth that has struggled with those same things to mentor instead of like trusted adults, because at the end of the day, parenting can only go so far, you know what I mean? I feel like they need somebody that can get on their own level, you know what I mean? And not like, because I feel like as children, because I experienced this when I was a child too, like parents don't really get it or get the extent of it. I mean, they try to help, but it's not the same like talking to an adult as it is talking to another person, like another child that's like you know what I mean? So like I would like to see, more like mentor programs that are, are like big brother, big sister type programs that are helping other kids get like mentoring from kids that are like them, because I feel like the rates for like suicide and all these other things, like behavioral issues and stuff would significantly go down if there was a safe place for kids to talk about without judgment. Because I feel like when parents hear those kinds of things, even though we don't mean to because we're worried, we just automatically like kind of try to mediate it, but we kind of jump to like the worst thing, like, oh, like let's get on the ball, like let's take care of this, instead of like, okay, like how are you feeling, like how can we deal with this, like talking on their level. And I just feel like it could help a lot more, if that makes sense.
Yep. Yeah, thanks for saying that, because what you're naming is some of the complexity of suicide prevention and the work that we need to do, because it is true, kids go to other kids. And so that is why it's important that we have curriculum in schools, that we have opportunities for kids to be peer support to each other, that we're growing those opportunities. Jill and I both, because sometimes we are of one mind, both put the youth line in the chat, which is a peer support line for teens.
Yes, but I do feel like the rates for children like getting on drugs or suicide rates are getting way higher for like younger children. I'm sorry. Hold on. I feel so strongly about this. I'm actually a survivor of this too, from my youth, and it actually happened with my son too, where he experienced those things and it wasn't dealt with properly, and it made me so upset that it wasn't dealt with properly. And I know when I was going through that, I felt so alone in that. And I would say, like making sure that even if it's youth, that are dealing with it, and even if it's like because the rates for these children, it's getting younger and younger each year. And I want to make sure that like if there are youth that are helping these other kids, you know, that they are aware, you know, of the impact this has, you know, and that they are able to speak and articulate themselves properly amongst others. So is there a way that we can like work on like maybe like trainings or something, like in case like any of these kids who have been there like want to volunteer to help out these other kids, you know, for the younger age range? Because I mean, it's really sad to see. I mean, there's the age range is like getting so young, and I don't want to see any more kids trying to harm themselves. I don't want to see any more bad blood out there, you know. I want to help in any way that I can. So please, if there's anything that I can do, please let me know. And if there's a training or something that I can do, please let me know. I'm more than willing to participate and help however I can, you know, and try to get awareness out there, because I really do believe what you're doing is so important, you know, and I feel very strongly about it because I was there back in the day myself, you know, because of my own past. And I apologize. I'm having a hard time. I'm getting a little bit choked up. I want to try to help however I can, you know, so please just, if I could get your guys' contact information, you know, try to help, at least in my community, I would like to, you know.
Yeah, we'll take you. Your passion and your heart are very loud and very clear. And just want to name that that this is the work. Like none of us are in this work unattached to the heaviness that that exists. And so yeah, thank you for bringing your full self into that. And I know that we have 1 minute left. And I wouldn't hate breathing maybe together before we leave.
Yeah, I do see there's 2 more questions, and I also want to be mindful of time and that this has been a heavy conversation. So what I would like to do is give us that minute to breathe with one another, and then I will continue to be here for others that might have some additional questions. So,
yeah, I just want to real briefly, besides the aunt and uncles, let's keep in mind that Youth Era has peer mentors that I often get involved in the youth that I work with. So Youth Era, peer mentors, and sometimes there are local programs, and people may not have heard of Friends of the Children, based in Northeast Portland, but they pay social workers to be longtime mentors for really high needs kids. So even some local programs, people locally may not be aware of. So I want to highlight those ideas as well.
thank you, Kirk. Jill, would you be comfortable leading us in an activity, or I can, either one?
Oh, here's a good one.